Health professionals see the effects of air pollution every day. It's visible not only through allergic reactions and respiratory and cardiovascular diseases, but also in the cost of health care. We sat down with Dr. Roger Johnson and Dr. Majid Koliat and asked them to talk to us about their thoughts on the health effects of air pollution.
So basically air pollution, for me as a physician, is pollutants or substances that are in the air that shouldn't be there and that can cause humans disease or symptoms or even mortality.
Air quality is a term that is used to quantify the small and big particles in the air that might affect the health in direct and indirect fashion. In my job, seeing patients with allergies and asthma, it affects them in several ways. One is outdoor air quality, and the second is indoor air quality. Now, the concept of outdoor air quality is mainly looked at as pollution, and pollution in layman's term can be qualified into two parts. One is small air particles and large air particles, and those affect the airways in various ways. But also there is indoor air quality, which is also important, and that is mostly induced by the inhabitant of that dwelling.
How do the air pollutants, pollutants in air affect the body? Most of it is related to inflammation, which is essentially swelling, and the body's response to the pollution, to the air pollutants in the lung and in the bloodstream itself, actually, causing narrowing of the airways, increased white blood cells in the lungs, fluid accumulation, and damage to the actual cells in the airways that participate in exchange of gas, and also participate in how the lungs are clear mucus and other pollutants. For the cardiovascular system, there's increased risk of formation of blood clots, decreased oxygenation of the red blood cells themselves, which leads to less oxygen to the body. There's also increased risk of rupture of plaques in the blood vessels that are formed by hardening of the arteries that can lead to heart attacks.
We know that asthma is caused by multiple causes. One is gene, the other is environment, and those interactions. So if you have a susceptibility gene, you might be more prone to have long-term effects from pollution. There are certain genes that are known if a child carries them and they're exposed to smoke, they will develop asthma, like secondhand smoke. However, a different child exposed to the same amount of smoke might not develop asthma because they don't have that gene. So it's an interaction between gene, genetics, and environment. At the end of the day, we all pay for this, directly or indirectly. If someone is a beneficiary of a government program when it comes to their health care, whether it's Medicare or Medicaid or any other version, this comes from tax monies. If it's coming from a private insurance, it's coming from the premiums. So someone has to put the money in. We are putting the money in, directly or indirectly. Some more, some less, but we can all affect the outcome of pollution. Each one of us, by doing our small thing, we can make a big difference.
So it was a great day when we passed the Evansville City Smoking Ordinance. We knew that we'd affect the health of a lot of people in a good way. We knew that more families would get out and enjoy the entertainment the city has to offer without having to worry about air pollutants, which would be secondhand smoke. And business has picked up for a lot of businesses. Workers are happier, and it's just really been great for our community. So a few years ago, when we were getting ready for this big ordinance push, we really wanted to show the city what kind of benefits they could see by making our air cleaner. And that's when we contacted Dr. Kraling from USI, and he was such a great help in helping us put together this air monitoring test. And the results were quite shocking, to be honest.
When we looked at the data, we saw levels that were in the hundreds of micrograms per cubic meter. Okay, that's just a number, but when you compare that to the healthy levels of air or the quality of air that you would expect in a typical home or a place out in the fresh air, those levels should be below about 20 micrograms per cubic meter. And so we were seeing sort of about 10 times that level in many of the places.
So when the air monitoring study was completed, obviously we presented the results to the City Council, in which they saw that this wasn't just a preference, this was a real health concern, that the air in these bars and businesses where smoking was allowed was not just unhealthy, it was hazardous. It wasn't a choice that we could sit on for a while. It was something that had to be done immediately because, as Dr. Kraling's results show, the air that patrons and employees are breathing in is very unhealthy and very dangerous, to be frank.
I think I was a little bit surprised that the reduction in the particulates was so dramatic. It was remarkably consistent that in places where you were not observing people smoking, we could measure the change in air quality very consistently. Where you put in policies that limit smoking inside buildings, the amount of these very small particulates goes down very dramatically.
You can watch this and other archived episodes of Healthy Air, Healthy Communities on our website. Go to video.wnin.org and search for Healthy Air, Healthy Communities. Or find us in the program drop-down menu. And please like us on Facebook and let us know what you think. On the next episode of Healthy Air, Healthy Communities, learn how the fuel-burning automobile became the transportation of choice and how switching to unleaded gasoline made such an important difference in our country's health. This has been Healthy Air, Healthy Communities. Thank you for watching.
Funding provided by the U.S. Department of Transportation CMAQ program.
Being in a hospital every day, we see the impact of what happens when the air is not clean. We see children coming in with asthma attacks, and you feel for them, and you feel for the parents, because there's really nothing that they can do. They come to the hospital and say, we need your help. We also see the effects of secondhand smoke. In fact, there are people in our community that have had family members die, and all contributed to secondhand smoke. Can you imagine in this day and age? It just doesn't seem fair. We see the effects of cigarette smoking. We see the effects of lots and lots of combustion out there. Please, let us work together to have a healthy air so we have a healthier community.